It's managed by a team of people who are employed by the Planned Parenthood Action Fund. It has its own board and its own fundraising, and zero federal funds are related to the Planned Parenthood Action Fund.
Hold on. No, hold on.
We do a variety of services, and
can you explain,
Ms. Loomis, those numbers aren't connected.
How many?
What I would say that, again,
I would very much appreciate it.
It's important to understand for everyone here how
Can
the
you
Medicaid,
function? Let me ask you this.
if I could just have a moment to explain.
You're using federal dollars
1.6 million
and displacing money.
Situation that she was in, and I believe that.
That's
and again, at that.
But Ms. Richards, that's not what you said.
Editing, it happened. It was days later that we were able.
Which true statements in that video?
The compassionate care that we provide.
Okay, well, that raises an important question.
In a non-appropriate way, and I don't believe.
And I don't believe.
I've told that to Dr. Nucatola. I will also tell you,
why didn't you say
Dr. Nucatola, we may just have to agree to disagree on this matter.
I don't think we're agreeing to disagree. I think you're not answering my question.
For the record,
Mr. Chairman, real quickly, just for the record.
But it's not a core service, so it depends on the state.
It's not a promised service.
We don't make money off of cancer screening.
That's great. If you could just respond as quickly as possible.
I think this question was raised earlier. I can't tell you.
You can't tell me how much you actually make from abortions. You can't.
They're audited financial statements.
I wasn't even asking about the affiliates. I'm just.
Well, that's where. And federal funding does not pay for abortion.
So
except
what
in
I'm
very
trying
limited
to say is,
hospital or healthcare provider to provide
but you
services
have also made.
Actually, it's revenue that we use for services. So one example, we do raise money over expenses in order to supplement the cost of Medicaid services.
So let me ask you a question.
Focuses on serving as many patients as we can, and so your example.
That is not exactly true.
But other organizations to lobby extensively to try to protect particularly low-income women.
One more.
Every single organization would be
But your affiliates gather that. Let me ask the question.
718,474.
But wouldn't you think the 3%?
She has never worked at Planned Parenthood, and
you can categorically testify.
Doctors and healthcare providers that will take new Medicaid patients. That's something everyone struggles with.
Let's go further. I do have some.
There's not always total efficiency.
Okay, well, let me go on.
The federal government isn't investing in our expansion. In fact, the federal government.
You've got 127.
I would say I really stand by the fact that we provide health care to many, many women in this country who have no other option.
The question, Ms. Richards, the question was.
Well, I'm not going to speak to every other hospital, health care center, and FQHC in the country.
Health care to women?
I actually don't believe that's accurate.
That's what's reported here.
Work on behalf of, we support anyone who supports women's rights.
Mr. Chairman, I'm reclaiming my time.
Need of our services, and we try not to judge.
And I'm sure that there have been.
That we trust women to make their decisions about their pregnancies. I've made my own decisions as well, and so I feel like I walk. Those are not the words I said. I said sometimes people change their opinions.
No, it's not always what you say. Sometimes it's just what you mean.
In fact, 3 in 10 women in this country have accessed an abortion.
So you define abortion as health care.
We don't make a profit on anything, but in terms of Medicaid.
Well, it depends on how you. You have 127 million.
To supplement what it costs for.
So you may make money on some Medicaid.
So what you've done is narrow the scope of the practice. So where there's profit centers, this is my time. This is my time. So don't interrupt it.